Baptist nooses. But he was Presbyterian. Well, thank you all very much while we're getting the anti-speaker virus software up here to try to get the lecture thing all set up. I apologize. I feel like I'm kind of at the end of a long tunnel here. I'm not used to this being from sort of a level Mount Olympus this far away. So if you do have questions, please let us know. Because we're videotaping this thing and trying to get your responses, if you do have a comment, if you do have a burning question, please come out and use the microphone. My other two co-presenters who are sitting back there hoping I won't call them and come on up here. I'm going to put them on the spot because I'm going to make them come up here. And this will be Ryan Bransky and Ling Lu, mainly because they are equally responsible for all this stuff too. And so if you do have a question, they'll be able to help answer it and also be able to hop on in with part of these presentations. Pretty much, let me go over a little bit of why we're here. Now, let me just check and see. Now, am I supposed to hit the left mouse to get this thing going on? Yay! Okay. What we're trying to do here is, and this is kind of reiterating a little bit of what Chris has down, and for those of you who hate taking notes like I do, the slides are mostly in your packet, except for those ones we kind of shoveled in there at the last minute. So please use those packets there and make your notes. So as we go along here, we're going to be trying to create this module, but obviously, I'm a clinician. They're used to refer to as a nose picker. And so consequently, I am not a music educator. And no one is ever going to tell me to quit my day job to go and perform musically. But by the same token, I need your information to figure out what stuff I have stuck in through here and with my associates in the textbooks is going to be relevant to what you need. So, please use those things, mark those things, make little additions, like why didn't he put this on down here? Because that's the stuff we'll be incorporating into this talk. And so you can send it to us, send it to Chris, send it to me by email, whatever, so we can keep chugging along. But for the purpose of this discussion, we're targeting the undergraduate music student. And so it'll obviously spin off into other things, but this is our target for this, is to try to keep our students healthy, because they aren't worth a flip if they aren't. We're going to be trying to educate these students to reduce their risks so they don't get injured. We also need the administrators and faculty, because without their buy-in on this thing, it's totally of no value whatsoever. If it sits in an inbox in somebody's desk or in a drawer someplace and never gets to the student and never gets communicated in such a way that they understand it, it's totally futile. So we're going to have to get access to people somewhere, and this is not how we do the access is not the focus of this particular discussion, but something we need to keep in the back of our minds for later on. And then out of this, we will be able to, obviously in our own individual fields for personal gain or what have you, springboard with this information into other aspects. So we all can benefit from this regardless of whether we're into research, education, clinical medicine, or what have you. So we'll try to be kind of focused on this particular thing. Now, one of the things I'm going to try to avoid is one of the things that came out of a famous Dilbert cartoon, and I've gone through all the same lectures you have by well-meaning MBAs. And what happens is you tend to pick up a lingo that I know I've got, and I know you guys have got, and I know the researchers have. And so if we can avoid kind of breaking down these things and talking more or less of a common language and not becoming the usual jargon-spewing robots that we know all too well, then I think we'll probably be able to actually communicate back and forth with each other. So you'll be hearing from the other groups, the hearing health, the mental health. Some of you probably may need the mental health after I'm done with my talk. And we'll go ahead. So how did I get into this? How did we get into this thing? Well, it was by listening to other people. And so for ENT, or especially those taking care of voice, we all go back to Manuel Garcia, who was one of the first singing teachers back in the 1800s who actually saw a larynx. It wasn't a doctor, it was a singing teacher. And so out of that curiosity, that's what jumps into other things. And so we need some kind of notations on this thing. So we're talking about not singing through the top of your head. Little things like that we hear. We need something that we can uniformly relate to. Friedrich Brodnitz, who took care of the Metropolitan Opera for many, many years back in New York, who I had the privilege of spending some time with, he said, you've got to know this if you're going to guard your health and to handle any danger. So we need to provide this information. Richard Miller, who is at Oberlin, who I've known for more years than I want to know, and we've shared some bottles of Romanian wine, which I don't want to remember. We talked about how it's important to get into, in the case of singer, the preventive medicine is the best medicine. And one of the problems is that you routinely, I'm on the tail end of this thing. They've already busted it. Well, I would like to try to keep them from getting to that point if at all possible, which is why Chris was able to sucker me in on this project, and I'm happy to be here. Johan Sundberg, for those who are into the research aspect, is a delightful gentleman who actually can sing a duet with himself using helium. But have anybody seen him do this? By the way, it's remarkable. But he's done some incredible research on studying these things and noticing little things like after a cold, after alcohol consumption, tobacco smoke, and actually measuring the changes that occur. So we can bring in the whole aspect in terms of habit, function, molecular level, teaching level, clinical level, and try to incorporate all this. Ling Lu found from just talking to her students, we asked, what do the students want? And so she has a questionnaire and asks them what they want. And they want to know this basic information. They're demanding it. They also want to know, what do I do to not abuse my voice or to stay in good shape? And what diet is good? What diet is a fad? Trust me, you go to any bookstore and see all the diet books, nobody knows anything. And so we need to know what we can tell these people, what medicines are bad, what habits should they do. Is it a good idea for a piano player to play handball? Probably not. And then what do they do when they hurt themselves? Now, in your handout, you do not have to read this right down. These are a lot of different references that are out there. They come from a variety of sources. They come from the physiological level, the singing teacher level, from teachers, from researchers. Some of them are members of our committee that we've been able to be happy to incorporate their acts, and they'll be working with us on them. And even come back from just compilations of things going back to the Nats Journal. So there's a lot of aspects on here. I encourage you to look at some of these. If you have a burning issue, they're there. But some general thoughts on this. One of the things is that you can't cram. When you're dealing with somebody doing a performance, the idea of cramming and doing it in one day, as your students have woefully found out for themselves, doesn't work. And so something has got to be done very gradual and extensively, and that involves discipline, and that ain't easy. So there are no lottery winners when it comes to winning a piano jury. You've got a lot of work gradually built in on this thing before you get there. Number two is that, unfortunately, unlike what the politicians would like to tell us, we are not all created equal. And so one bit of advice for one student will not apply to all of them, and therefore you're dealing with a training and performance schedule that can't be cookbooked. And so we have to find some way of getting around that. Number three is that it takes time to recover. And everybody would like to be well instantaneously after singing or performing or straining their voice. It doesn't work that way. Sometimes you just have to plumb shut up for a while. And it's hard to get people to do that, particularly with telephones, cell phones, friends, telemarketing, and all these other little things they have to do to earn a living in the spare time. Well, this is my little bit of ignorance, and this is why I rely upon other members of the buffalo herd here to figure out where we're going. And this is what we're going to be trying to do with all this. So let me plunge into a little bit of this aspect in terms of the general content. Okay, so we'll cover all these little aspects here, the anatomy and physiology, and trust me, this will be a bare skeleton. If we went into either one finite portion of this, we'd be here for a week. So we'll go in the anatomy and physiology, how they work. These are things I think are probably important for us to teach them. General health, the good and the bad habits, the voice disorders. Not frequent ones. I don't want to scare the heck out of them with arcane spasmodic dysphonia and vocal nodules unless it's necessary. We're dealing with the undergraduate student who basically is a hopefully healthy individual aside from the things they do themselves. Oops, did I? Oh, there I just slipped down. And when not sing, and then the roles that the health providers have. They have some roles, sometimes they don't have roles. We just need to figure out where it comes in. I don't expect every single person who goes like this to come into my office waiting room. And so we need to figure out what should they do. In the anatomy and physiology section, for voice, it's fairly easy. The dancers have a much more complex subject, as do the piano players and some of the other musicians. But for voice, we got the larynx, we got the respiratory system, and we got the articulating structures. Beyond that, it's all very, very important, but it's not the key into this. So yes, indeed, you need to have good posture and all that sort of stuff, and that's important. But to keep it simple, we'll just talk about the vibrating sound source, the thing that sounds like a buzz, the respiratory system, or the bellows that pushes the air on out, and the articulating structure, which makes it sound as good as it does, and to get the pronunciation and the diction and the coloring that you need to for the singer's format. So The larynx, that's just a vibrating sound source. It has biological and non-biological functions. It has structure. It has mucosa. It has physiology that we need to know and understand. And the laryngoscopy is how we see it. And there are a number of different ways that we can look at this thing to see and try to study what's going on. What does it try to do? Well, one of the things that takes a lot of people time to understand is that the larynx's #1 function is not singing and talking. Its #1 function is protect the airway. And by God, it's going to do it come hell or high water, which means the person who eats a little bit too fast while carrying on a conversation after having 3 glasses of wine, they're likely to aspirate and have it go down the wrong pipe and cough and sputter for a while, and may swell up the cords to the point that they don't do very well. #2, it's supposed to open to permit airflow in and out of the lungs. And then finally, a distant third is the phonation. And so if there's any problem with 1 and 2, you ain't going to do #3. And so we have to kind of bear in mind that aspect that it is low man on the priority as far as the survivability of the human being. The structure framework, we've got cartilage, bone, and membranes connect to each other. Well, again, it takes some of our students the time to realize that it's under the same rules the rest of the body is. So you see all of these runners out there. What do they do before they run? They stretch. They warm up. They practice. They don't run a marathon with no practice. They start out slow and build themselves on up. Why? So they can do it and not get injured. It sometimes takes a while to beat these kids over the head and get them to realize the same thing they have to do with these little muscles. Yes, they're smaller and they can't see them, but they're under the same rules and regulations. And #2 is that the innervation is very complex, and it can be screwed up by a lot of different procedures and operations that people might want to do on them. And we have a lot of pictures and diagrams and models that we'll demonstrate to try and show these things. And some of them will have to be, can be in still, but some are going to have to be in a video format to get them to understand and realize it. The lining of the mucosa thing is exceedingly delicate. People do things to their voices they would never do to the white of their eye, and yet it's about the same delicacy. And so we have to kind of convince them that, you know, taking this thing and going poke, poke, poke in the eye probably didn't feel very good. Well, it's not very good for this either. It's affected by the same irritants, humidity, hormones, aging. Sorry about that, all of us who are getting there. We're all running into that thing, I'm afraid. Diet, allergy. You know, students don't realize they're going to age someday, but you know, it's either that or die. Allergies, inflammation, overabuse. The diagrams to illustrate it will have those available, and the nature of the layered histology. And this is something that took us a long time to realize. Most people at one time felt the vocal cords just went slap, 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 slap. And the faster they slapped, the better the vibrations. Well, it doesn't work that way. And so it took a lot of very intelligent researchers to figure out that you had a quality of flow of waves across the membrane that was in multiple different layers and behaved like different consistencies of jello. And you had to have them just right and have them equal on both sides in order to get the desired response. And it can also be messed up very easily. Videos of these things help a lot. There is a device called stroboscopy, which seemingly pretends to slow it down, gives us the image of slow motion on the thing and tells us how well this wave motion is going because it goes too fast. It's like, well, back in the old days, those of us who used to do timing on our cars with timing lights. Anybody remember those days? That was basically a little strobe going back and forth, and you actually saw what looked like the little timing strip going back and forth and back and forth. Well, this is what the strobe does. So the video of this can show what's going on. And again, we don't want to scare them with big cancers, but we can show what happens with laryngitis, with nodules, hyperfunction, edema, smoke irritation, pregnancy, hormones, and things like that. So here's an example of a soprano, and this is the thing we're working on this morning to see if we get this to work. And this is looking at the vocal cords. Now, remember, we're looking at this as if you're standing on the tongue looking over. So right at the top of the slide is the back, the front is in the front, and then as you look on stage on the right-hand side, that's the patient's left side. And so you're looking down the V shape of the airway down through the little cartilage, and then food decides to go slide on down away at the back. And she's singing right now, but those cords are going in and out, and vibrating with very, very slow motion, where the air pushes on out. It does not go slap, 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 slap. And so this is one of the things that we're going to have to convince them is how the thing works, that it works a little bit differently than they might understand. Okay, now, how do we go to the next slide? There we go. So we'll need to teach them how the folds vibrate, what controls the vibration, what pressure. Now, we always talk about push from the diaphragm, push from the back, push from whatever part of the anatomy, except for the shoulder blades, thank you very much. So how do you do this pressure? How do you do this flow? How do you do these muscles? Why do you use big muscles rather than small muscles, and overview this thing so that you determine the quality of the phonation. In other words, put these things in words that everybody can understand. The teacher, the student, the doctor, the therapist, everybody. When you look at these things on still, this is a normal looking larynx with it coming together. That little gap at the back is not abnormal. We actually see we see it more frequently in females than we do in males, but that's a very normal finding. We have to teach our clinicians not to go absolutely bonkers when they see that and say, oh, it's horrible, it's pathology. No, it's not. You didn't see enough of those. Okay. So these are little things we have to actually teach the people in town, because you're going to have to relate with the medical community in your town who may be good and may not be so good. And you're going to need to find that out. How the physiological parameters are evaluated. How do we evaluate these things? What do these abnormal numbers mean? What's the difference between men and women, vocally? And what therapy do we do to help these poor people? Well, the methods that the doctors or the therapists use, we use a little mirror back there, just not much different than what Manuel Garcia used to use. We use these fiber optic scopes, slide on down there like you used to see on some of the police shows, where they slide the fiber optic scope under the doorway and look and see the terrorists making bombs, for those of you who saw Patriot Game. Okay, well, we use the same thing in the office. We clean it up a little bit, but it goes in the nose and looks on down, sees the vocal cords. We also have a rigid one that gives us even better light, which is much better than the old high-speed video cameras, which practically gave the voice box a sunburn that used to be back in the Paul Ward days. So what do we see with these seeds? Which one is important? How much does it cost? And what are the examples of these? And these help the student as well as the therapist, and we use these a lot. The subglottal pressure generator. That's what drives this thing. As far as the vocal cords are concerned, it could care less what's going on anyplace else. It's the air that's coming right on through there. And so we need to let them know, why does it make a difference? You know, why do you not try to sing with a full stomach? Why do you not sing very well when you got a busted rib? Why do you have problems singing when you're 8 months pregnant? You know, why does it not work too well right after you had abdominal surgery done? These are a lot of things that are important to know about and will relate to how we kind of keep these people out of trouble. The lung measurements. This is getting into really a fun field, especially as we get more and more people with asthma and people with respiratory problems. And God help us, there's still singers out there who smoke. And what's going to happen eventually with these poor dudes, because they ain't going to win on that fight. And so what are these measures? And plot example, what happens when they sing and speak? And we translate that over to speakers too. I'm talking about singers, but all professional vocalists who can be auctioneers, CEOs of corporations, deans of music schools, okay, teachers. And teachers have a tremendous problem with injury with speaking. They are speaking day in and day out, and I'll bet you the acoustics in your environment are pretty lousy. And sometimes you're tired, and you're worn out, and your hours are too long. And then worse yet, some people will sing in the car. Okay, so we need to let them know all these things. And so we'll go over all these subglottal pressure, the air groups, glottal resistance. Now the catch is not to do it so you blow a person's brain out. You can only go so far on this stuff, and sometimes on some of these things we'll do a smattering, which won't be the same thing you're going to get on a research basis. But this will allow them to at least read and knowledgeably understand things. And then when some of those students do know are interested in, where do they go to learn more? Okay, we don't have to teach it all. And then how these problems change with singing. The articulating structures, most of you will use those on a regular basis, especially those who had breakfast this morning. Lips and tongue and teeth and jaw and soft palate and throat and larynx position. These, you know, obviously a person who's got TMJ and a sore tooth, they don't do too well. A person who just had the tonsils out is not going to be able to sing an aria quite right away. And where your larynx position, how many people have to deal with real high voice boxes versus real low voice boxes in positioning of the larynx, and which is good, which is bad. Sometimes there's conjecture, sometimes there's disagreements on it. The fundamental frequencies, these are again where you learn the information to understand the research papers and what's the difference between these various sopranos and basses and the singer's format and gender differences, and what happens with age on these things. We're only beginning to understand some of this information. The tongue position, a lot of people make a big important to do about where the tongue is placed and where the larynx position is. Okay, we go into general diet. And again, these are things that we want the student to know. One of the old adages is drink enough water so the eyes, nose, and mouth are not dry and the urine is pale yellow, or as one person used to say, pee pale. That goes back a long way. So it's very simple, and you have to kind of give the information in a form a person understands. Unfortunately, A lot of people have learned how to be roughly like kangaroo rats and to be able to drink no fluids for a 24-hour period of time and go bathroom about once every other day. One of the other problems we also have, those of you who got up this morning or had time zone changes, is caffeine. Now you got to remember, I'm an ex-naval officer. I drink caffeine like it's going out of style. But it does promote urination, and that means that you rinse the water. You don't really keep it for very long. And so you're going to need to have some more water in there to lubricate the cords. Otherwise, sooner or later, you'll be starting a line like this, clearing the phlegm out of your throat. And that's not good for a singer, because we saw those nice little waves going together through there. That's not what it does when you clear your throat. It does slap together. And those of you who have gone to a concert and you really loved the concert and you applauded like crazy, what do your hands feel like after it? Not as good as if you went to a lousy concert. Okay, rest. Rest is very valuable. You need to have it. It's a medication. Now the question is how much? We don't know. That's what we need to find out. It includes singing, yelling, talking on a phone, which is why I have a lot of problems with that. This is my teenage people getting to not include talking on the phone with voice rest, and stage whispers, which aren't very good either. Exercise, another big thing. Unfortunately, I have one of my members up here who exercises a whole lot more than I do. I don't think I could do I couldn't do a triathlon if my life depended on it. In fact, I'd probably kill myself. But it is good for the mind and body, and we need to know how much, how should they do it. It's good. You need to do it, but how much is good, what kinds are good, what type of conditioning they need to do, what kind of abdominal strengthening exercises, back strengthening, glottal straining. These are all important. The medications. Now, this gets into a real bugaboo because people think that the only medicine that counts is one you pay a zillion bucks for at the drugstore. Not true. So we need to know, and they need to know, which effects are going to occur from the things they take in their mouth, and that includes the thing they get at GMC, or they get at Wild Oats, or they get it wherever else. You know, just because it says natural or herbal doesn't mean it won't do something bad. And then we've got the illegal ones. And we know, it never happens to our students. There is never any student we ever have who's ever smoked a joint in their life. Hardy, har, har, har. Okay, so we've got problems with those, and we even have problems going down to methamphetamines and what have you, which are running rampant. And so unfortunately, we've got to pull our heads out of the sand, be aware of these things, and to be able to recognize them, and to let them know what they're doing themselves, and try to get help. The abuse, one of the things that they need to realize, and unfortunately all kids think they're immortal, so it takes a while to realize they're not, but that given enough alcohol or tobacco over time, all voices will deteriorate, which means you will sell shoes at Kinney's and you will not be singing. And unfortunately, they'll say, well, I knew so-and-so who smoked 3 packs a day and he lived till he was 90 performing. Well, that's true, but the problem is that who is it going to be? Are the odds with you? The answer is no. And so how much damage can you get away with? I don't know, and they don't either. So those are the things they need to recognize. And illegal drugs will impair their career one way or another, either by injuring themselves or sticking them in the hoosegow. Okay, now we get into the organic and functional problems. Well, the organic, that's something I can see. Okay, I can see organic stuff. The functional ones, I have a hard time seeing. That's where I have to rely upon my PhDs to bring that information, because they can sometimes help find the stuff that I can't see and to help study all that and detect the physical abnormalities. So sometimes, a lot of times, we think are functional. We say, it's on your head, you're all faking it. It takes us a while to figure out, oops, I didn't have the right tools. I couldn't see what was going on there. And we found that with stroboscopy. We found it without studying. We also discovered, lo and behold, there actually is an organic response there. We just weren't bright enough to find it. Some of the organic disorders, the most common ones, acute laryngitis. It suddenly gets inflamed. The xerostomia, which is the buzzword for dry mouth, some people call it Zika. There are a lot of different words for it, but it just means your whistle is dry. Medication effects, chronic laryngitis, and growth on vocal cords. Are these all the organic voice disorders? Heavens no. But this is probably the biggest top of the list ones, and we can get into other ones if you feel it's important. This is where you guys come involved on this thing, is what is important to your students. The acute laryngitis, well, if you think about medical terminology, is a big thing about big, long, 2-bit words. If you really look at it, all it consists of is a couple of Latin syllables slung together. So, larynx, duh, okay, it's in there. Itis, inflammation, tonsillitis, laryngitis, arthritis, encephalitis, okay, there it is. All it is means the voice box is red. So you're going to see this over and over. So I want to demystify the medical terminology. Oma is a lump, okay? something oma, like lipoma. Okay, it's a lump, period. And you got the itis, and so we'll kind of learn all these things as you go along, and they're very, very easy. Trust me. If you can play a minor third, you can do this stuff. Okay, so trauma. Okay, yelling is a simple form of trauma. Acid reflux, someone hits you in the neck. Infections, viral, bacterial, yeast, there are a lot of different things like that. These are the simple ones. You can also get allergies tossed in there if they get a sudden, brief sniff of their cat that's curled up on the pillow. Hemorrhage of the vocal cord. This is one of the things that's the emergency. Okay, this is the thing where your career can go right away with no problem, because if they rupture the cords and they continue to sing on it, to sing through it, to play hurt, not a good idea. And that's one of the things where we tell them, zip it until the thing is cleared on up. These are some of the things that we'll see when we look in at a voice box with the vocal cords. And again, same view where down is to the front, and where the vocal cords will be blown apart by the air. They'll sit there and they'll kind of come together again. And so any little abnormalities in any part of that will change the quality, and sometimes the voice will get a little raspy, or sometimes it'll get a little breathy, or you'll get the nodule type sound. You sound like Rod Stewart after a while. And so there are a lot of different sounds you can get from here depending upon what kind of pathology is down through there. For vocal cord hemorrhages, I'll spend a second on that one because that's probably one of the most critical things. What happens on that? Well, that's where you're singing along and all of a sudden, your quality goes right in the dumper after a first. I just had one Grammy Award-winning vocalist I saw about a month ago, and he sneezed. His was just a simple sneeze. Kaboom! Vessel blew out, and his voice was out. So, unfortunately, he had one more piece to do. What did he do? Hey, the show must go on. He sang through that piece. About strangled him, but that's okay. He almost had the laryngeal trauma after he did that. Yelling, singing, shouting. It's usually painless. Doesn't resolve in hours like some other little simple edema or swelling will. And it may seem similar to other spells. A lot of people have similar spells like this in the past. They just don't know what they were because nobody looked down there. So we tell them not to saw, not to talk, not to sing, not to whisper until I tell them it's better by looking down through there. And then sometimes there's an underlying defect. We had one, I was not talking out of school because she's made it very public, Kathy Mateo, who's a pretty famous country singer. She had these varices, these little dilated veins on the vocal cord, and every time she had her menstrual cycle, they blowing up again, which actually dates back to old stories about how the Italian opera companies used to take their sopranos and they would be on voice rest and they'd have an understudy come in during the first part of their period. It doesn't have to be for everybody. For some people it's important, especially if you pop a lot of aspirin and Goody's headache powders and things like that. So if there was a problem like that, we can literally weld those vessels shut and keep them from flaring back on up again. So there are things that can be done for these if we recognize them. The dry mouth, or xerostomia, zero dry, stomia mouth. Hey, there's your Latin again. Dry mouth, nose, throat, larynx. Why? Most of the time it's because people don't drink enough water. Okay, that's simple. Hey, goes in, goes out, not enough goes in, you're dry. A lot too much caffeine, too much booze, Jack Daniels didn't count. You tend to pee it on out again. Breathing dry air. Any of you who've ever been to Aspen? Oh man, I had to sing one year when I was in Aspen. I thought I was going underwater. Trust me, man. There was no way I could get enough water in from that place. The humidity, the smoking, the smoky bars, smoky irritants. For those who do jazz, try to go to a jazz club that didn't have smoke in it. Okay, and unfortunately, if you can't use God's humidifier up there, you're already hosed. And so the people who got their noses busted in the past from their athletic endeavors or because they're born with the wrong set of genes, now you all of a sudden you're mouth breathing like this all the time, and next thing you get dry mouth. So you have to find ways around that. And unfortunately, as we all get older, it doesn't get any better. So what are the side effects that cause these things? Well, antihistamines. Anybody who's ever had an antihistamine and tried to play the flute? Didn't work. Or a reed instrument. I got a double reed man back there, and he can tell me what it's like when your mouth is really dry. The bassoon does not work very well. Decongestants, which are even worse. Blood pressure medicines. Unfortunately, as all of us become grayer and older and a little more pot-bellied, we get hypertension, and we have to take diuretics, and guess what? You get dry. Psychiatric medicines. Life depresses us enough as it is, let alone politics. And so a lot of us are on various forms of medications in order to make our moods a little happier, and the doctors are passing these things out like candy to their kids now. GI tract medications to take care of your GI tract. I talked to somebody who got food poisoning, and I'll bet you those medicines made her kind of dry. So you get other medications. You get the tremors, okay, from a lot of these medications. You can get tremors. You can get loss of motor control, and these little muscles don't do very well when you have loss of motor control. And any pain medicine will do that. Any cough medicine will do it. Any sleeping aid will do it. Any headache medication can do it. Any mood-altering drug can do it, and any alcohol can do it. Guess what? We're all on these things. Anyone going to the reception tonight? We'll be on more of these things. Okay, so we got the other problems, the increased risk of hemorrhage. Aspirin, well, those effects last for weeks. Just because you stop your aspirin 2 days before, it doesn't do any good because the way the aspirin works, it coats these little platelets which are in charge of making clots, and guess what? The platelet is hosed until it dies and gets replaced. And this is one of the reasons that I can't do surgery on somebody if they've had aspirin for the previous week. And so this is a person who, if they have a tendency to hemorrhages, they need to know this. The NSAIDs, this is an abbreviation of say non-steroidal anti-inflammatory drug. Okay, that's Advil. Okay, Motrin, Aleve. They also can do it, not as bad as aspirin. The anti-stroke clot medicines, again, those who get older, a lot of us are being put on these things. And they thin the blood out big time. Every time you bump into a coffee table, you end up with a bruise about the size of Texas. There's a little bit less with these guys at the bottom. And so that's why I tell everybody, yeah, Tylenol does kind of thin the blood a little bit, but it's barely. Okay, it's not that bad. And the COX-2 inhibitors I've not had as much problems with. And these are the Celebrex and the Vioxx and Bextra and things like that. And they cost a bloody fortune, but they work. Hormones, well, us guys, we don't know too much about this stuff, but we learn as we go along. And one of the problems is that it doesn't have to be a pill you punch out of a little circular packet. It can just be the ones that your own pituitary gland kicks into action. And so that can cause edema, that can cause bruising. Thyroid problems, which is a sneaky problem that occurs with the aging person. That will cause problems with the vocal cords. Pregnancy, which guess what? We're getting to see more and more pregnancy with people who are performers and get pregnant. This is women, not guys. And it will cause problems with the rhinitis of pregnancy. And anybody who's ever been pregnant, probably a good half of them have had their nose totally stuffed up like this, and they're going to kill somebody because they can't get their nose unplugged. And that means you get a humidifier problem again. And then finally, danazol. Now, this is something you guys all need to know about, even if you're male, is that there's a condition that women can have called endometriosis, which is a real bad disorder to have. And one of the drugs the unbeknownst gynecologists will throw at them, well-meaning because it hopefully keeps them getting surgery, is Danacrin or danazol. The problem is that in a certain unknown but high enough to be worrisome odd statistic number of people, it will lower their pitch permanently. Your coloratura soprano ain't no longer a coloratura, and she never will be for the rest of her life. So kind of bear that in mind, your singers who have this sort of thing. They need to know that for them, if they make their living with the top 3 notes of their voice, go for the surgery, okay? Because they're playing a game of craps here, and they may not win. And yeah, there are a lot of good mezzo parts out there, but hey, you know, they don't like that. All right, other steroids. Well, they got good and bad. That's good, the good, bad, and the ugly of steroids. It is a very powerful anti-inflammatory medicine. We use it for allergy attacks, reactions, bee stings, asthma, joint pain. It cuts down the inflammation, it interferes with singing, and some singers recognize it as being their life preserver. In fact, some of them will abuse themselves over and over and over again, planning on getting the steroid blast just before they perform. Doc, I gotta have my shot beforehand. Be careful on that one. Better off getting rid of the reason for the steroids than anything else. Vitamins. Okay, well, big controversy. There's a big fight here between those who write prescriptions and those who want you to give drugs without prescriptions. So consequently, how much double-blind study is there? Not a lot. Most of the time, the normal balanced diet is more than sufficient, but it depends on who you talk to. The old B12 shots. Anybody had people who got the B12 shots before performances? I get these singers coming to town all the time, and I get called out to the arena saying, I've got to have my B12 shot before I perform. It's mostly placebo, but it does seem to do some help, but there's not a lot of data to go along with it. But these medications and vitamins are not without side effects. We do get nausea, we do get headaches, we do get bleeding like with vitamin E, fatigue, weakness, and what have you. So these are not innocuous medications. We need to let these people know about it. Let's see, the illegal drugs. Well, unfortunately, we'd love to pretend and not talk about it, but they can be lethal. We do have them now in our schools. They do lead to date rape drugs, which are not good. There's no quality control on these things. You don't have an FDA-approved illegal drug. And so a lot of them will mix them with a toxic filler, and they have no idea how much they're getting. Accidental overdoses are extremely popular. And unfortunately, the methamphetamines are becoming extremely popular now. And if you don't know about them, for God's sake, learn something about it, because it's coming to your neighborhood soon. It is dirt cheap. You can make it with materials you buy at Walmart. And it's basically the hillbilly heroin. And the problem is getting very, very popular on college campuses because the young co-eds find if they take a little bit of meth, it's kind of like having 5 beers with no weight gain. It is booming on college campuses. And once you get hooked on that stuff, your chances of getting off of it are poor. You get hooked on meth, you're dead. It's almost as bad a death sentence as AIDS. So we've got to all be aware of this in our communities, because it's here. You may not be aware of it because no one likes to talk about it, but it's here. Chronic laryngitis, okay, that's a long term. That's the acute, but it's lasted for longer. Long-term irritated vocal cords. Well, okay, if you got trauma down there, speech therapy helps, okay? They'll help show them what they're doing stupid in order to get them to do a little bit better. They'll tell them about the caffeine which drives the cord, the allergies that make them red, the smoking that irritates it, the alcohol that drives it. These all can cause chronic laryngitis. It's the same acute stuff, it's just gone on for a lot longer. GERD, oh, you've heard a whole about that. Gastroesophageal reflux disease, and the other new one, LERP, okay, the laryngopharyngeal reflux disease. What are they? Well, the laryngopharyngeal reflux is the exact same thing, except you don't feel heartburn. Okay? So how many people you have coming in to say, I can't have this, I don't have heartburn? Well, dummy, you don't have to have heartburn. You can still barbecue your vocal cords with hydrochloric acid and not feel any burning in your esophagus. And unfortunately, as we all get older and muscles get weaker, it's not just weaker in our arms and legs and back, it's also weaker in these little muscles that keep the gut contents in the gut and keep them from coming on up to the voice box area. And I'm sorry, but 3 slices of pizza and a 6-pack don't do well just before you go to bed. So we have to get them to change their diet and elevate their head, and if necessary, use the medications. And if they do take the medications, they have to keep taking the medications. And at $1 to $1.50 a pill, a lot of them don't do that very long. So that's why you get into behavioral modification on this thing here. And so you'll see something like, well, this is a nice little tenor backing through there. And that area way at the back there, right behind the cords, that's the area that gets red and barbecued. And that area will get red, and it'll get puffy, and it'll get edematous, and we'll see it with our mirror as they come together. And once it gets edematous, then they start feeling like there's a lot of phlegm down their throat, and they'll keep trying to clear it on out, like that little white dot you see dancing around on that left cord there, going back, forth, that little white scuzz sitting there. That's a phlegm that they try to clear on out. And as they keep trying clearing the throat, they smack their cords together, and what happens, they wake up with this dry, froggy throat, and it gets worse and worse and worse with time. And we can see this. We actually can see, hey, you got reflux. Oh, I don't have reflux. Yes, you do. There it is. And that's why I've got my TV camera right in the office, and the TV screen, I just swivel the chair back. Dude, that is red. Okay? That's what you're doing. And sometimes it makes an impression, and sometimes it doesn't. Here's a nice baritone here. If you look, before I get started on it, those little dots on the back, and these are some really good videos that Ling Lu brought. Those little white dots back there kind of look like moguls for those of you who are skiers. Okay, that's basically little bits of tonsil tissue back there. They puff up and down just like tonsils do. You get the allergies, you get the postnasal drip, your stomach acid reflux, they get big. What happens when they get big? Well, they don't hurt you too much, but all of a sudden you feel like something's there, and you start doing this sort of stuff. So let's see, are you gonna start? Hello? Wakey, wakey. Okay, forget that one. Okay, go on down here. These are the views of the larynx, and you'll see little phlegmish stuff in through there, a little phlegmish stuff in there, a nice little, what we call the spit stringer, going back and forth like a little hammock. Okay. That means the saliva is a little viscous there. Hey, it's thick, okay? And so you can spot it sitting through there, and you can hear it. And so they sound like they're gargling sometimes when they're singing when it gets real bad. But this area back and through here, this is the area that'll puff up and get edematous with reflux. And why? Because there is where the food comes up, right here and here. That's looking down in the swallowing tube back there, and as it comes on up, away it goes. Okay, next thing, the infamous nodules. I have to be careful almost never to use that word, because you say it, it's all like a death sentence, and they all freak out and they get pale and everything else. Well, they're calluses, okay? See those little things here? Those are calluses. Okay. If I wear a glove when playing tennis, I don't get a callus. I play tennis without wearing a glove, I get calluses. I work in the garden for 1 hour, no calluses. 4 hours, blisters and then calluses. Okay, so it's just wear and tear. And so if you take the cords and you beat them up enough, you're going to get calluses there. What are calluses? They're nodules. Duh. But it starts out, they start very thin, go away fast, and they get harder and harder and harder, and finally they turn into big, thick, hard scars like you see on a longshoreman. They don't go away so easily. So the thing is the use and misuse that we have to teach them about, and how the speech therapy works to get them to bring the chords together. When you sing, you don't have to go whack, 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 whack. There is ways, instead of going E real bad, you go he, you ease in with an H. These are the things that they'll teach them how to do. So you can still sing, it still sounds good, but you don't whack the things together there. This is one of the problems we're running into for those of you who have voice recognition software, another evil thing. This is for those who want to type material on your computer, but you're too lazy to type, and so you talk into it, and the machine goes and types it on in there like a transcriptionist. Well, the problem is the only way it works is if you hit your words real hard with really big, firm consonants like this. And they even had an article in the Wall Street Journal about people having more vocal nodules and dysphonia because they were using voice recognition software. We're going to see a lot of this stuff coming out, so be aware. Polyps, that's a swollen area. You get trauma, allergies, smoking will cause some of the things, and sometimes you have to do surgery. This is where the surgeons love this. We enjoy these things. These are fun. But we'd like to prevent them in the first place. The cysts, granulomas, papillomas, the other little tidbits that form down there, these sometimes require surgeries. The cysts go up and down, up and down, up and down in size. I watch them for a long time, but sometimes they need to be whittled out. And cancers, fortunately, thank God, are unusual in this age, but as they go along, they do occur, and we have to know that they need to have somebody take a look at these things. Now, these are what some of the therapy does. This is a person here who has these little swellings in through here. And when the nodules come on very, very early, they'll be nice and swollen. They can also be a cyst, and sometimes the only way you can tell the difference between those is actually do the stroboscopy and see how things move over it. And when they come together, they get more of a gap back here than they're supposed to. And so you get this air leak when they're talking. And after they get 6 months of therapy on the things, they get smaller. Vocal cords come together easily. You just get a little touch of spit there where the thing once was, but it goes from that size in here down to there. Did they have surgery? No. They had, speech therapy, behavioral modification to make it go away. And that's the way we try to take care of these things if we can. The functional disorders, this is the abnormal voice, no visible abnormality of tissue. It's influenced greatly pro and con by teaching, practicing, performing methods. Some of the examples people have, they'll say, oh, my voice is tired. They'll overuse it, they'll get misuse, and some of you get them malingering. Oh, they're out there, I'm afraid. There's people who try to fake a disorder for some reason. Not a lot of workman's comp in the music field, I'm afraid, but there are other reasons why people sometimes fake things. So the vocal fatigue that you have there, well, the symptoms, you tire easily for no real reason. You can't figure, I kind of sing, and I can only go through one set rather than 3 sets. And some of the conditions, well, poor conditioning. Again, go back to thinking about other physical exercise like running. If you don't do conditioning, guess what happens? You fatigue. You don't make it for the 20 miles. You don't make it for the 10K run. You get about 5K, you start pooping on out. Poor technique, not doing it right. Poor warm-up, if they do any warm-up at all. Depression will do it. Big cause of depression could be fatigue, and a lot of kids have a lot of reasons for depression. Some are reasonable, some are not so reasonable. Nutrition, if they don't eat or their total diet consists of a moon pie and RC Cola, they're not going to do too well through the day. And general illness will also cause fatigue. So those are things you almost have to get into. What's their private life like in order to find out what the cause of these things are? The overuse, well, they'll get aching muscles. Oh, I'm tired, my muscles are aching through here. Loss of quality, loss of the high notes. Causes, well, too much talking and singing during the day. The talking and singing they do is more extensive than what you see in the classroom. Singing in the wrong range. Okay, they sing just right for you, but they're moonlighting over at the local pizza parlor and they have to sing Happy Birthday in a high range, these little things. Poor acoustic, poor mics. Most of the times when people are coming on, their acoustics are less than optimal as they're singing at the local bar. Singing over background noise, and I get a lot of that because I'm from Nashville. Imagine what kind of acoustics I got in some of the places we got around these honky-tonks. And then cramming for a vocal performance or jury. And I know none of the students at your music schools ever cram for their vocal performances or jury. Never. But at some of these other schools, they do. And so we need to let them know that that's not going to play out. Okay, the symptoms for misuse about the same. You just have to kind of look a little more closely at it, and this is where the training comes on in. So it's one thing to tell them this is what you need to do. It's another thing to get them to do it. And this gets to be a little hard, and this gets into a field that I have nothing to do with, namely the classics of teaching. That's why we got experts in here. The correct application of the training is important. Singing the wrong music, wrong range. There are always individuals who somehow think, you know, this dude here, he's a baritone, but I know he's a tenor. And they kind of ream him up a little bit. Sometimes that's not their range. Changing teachers. How many people have seen somebody who got vocal problems because they changed teachers? That's another tele issue. And then there's all the extracurricular stuff, which is very, very hard to do when you're dealing with hormone-raging teenagers and young college students who are away from home for their first time. And they yell, and they party, and they have a good time. This is the first time they've been under the thumb for 18, 19 years, and now you got to rein them on in and spoil the party. Malingering, yeah, there's a few people out there with screws loose, but most of the time you have to look around and find what the secondary gain is, whether they're too chicken to do a performance and trying to get out of it, they want to get sympathy because mommy's not there, they're trying to get a lawsuit, and you're fortunately not going to see that too often, and some other psychological problems, and unfortunately that is a real problem, and that's why the mental health aspect is vital on this, to understand the aspects on this, because this applies. Functional disorders of treatment, well, the first thing is trying to figure out what the deal is, and this is where the student-teacher, the teachers are the first interface. Address the issues, evaluate by somebody, an ENT doctor, that's our long Latin name for oto, ear, larynx, ologist, study of, and the speech therapist is not improved. All work as a team, and this is vital. You've got to have a teamwork. You've got to have people talking to one another. You have to have knowing one another. You have to have meeting with one another. You know, any way possible, and this means that you will have to go and do some wining and dining and lunching and bringing things together and get them to communicate, because this is a team. None of us can do it by ourselves. I can do everything I want to in terms of prescribing, but if they don't do what I tell them to, doesn't do any good. Warning signs that medical attention is necessary. That's me. Okay, the hoarseness, the vocal fatigue, the breathy voice, the reduced vocal range, tremor. Now this is arbitrary, lasts 2 to 3 weeks. But if you toss that out as saying, you know, if it only lasts for a couple of days, just, you know, time, rest, it'll probably get better. But if it lasts more than 2 weeks, 3 weeks, your antenna ought to wiggle that, you know, something is screwy. Now, something is not right down here. You might need to do something about it. There are some individuals who are very knowledgeably astute, and they know within 24 hours that they better get their high horse in someplace, and other people don't. You get the pitch breaks, the inappropriate pitch, the strain, the larynx pain, the sudden voice, aphonia, phonia, sound, aphonia, none. So aphonia, dysphonia, dys means bad. So you get dysphonia, bad voice, aphonia, no voice. So if they got a problem where it's not they're voiceless for about 2 or 3 days, not too good. And so by and large tell them to shut up. Don't sing when you're in hoarse and in pain until somebody figures what's going on. So, what happens when it comes to see me, or a therapist of some kind or another? Well, first thing I should do is get a good history. And you can't do a bum's rush on these people with a 5 minutes in and out. Okay, so if you got somebody who's a speed demon and likes seeing 60 patients in a day, that's probably not the ideal person to be seeing this individual. You got to take time on these dudes and kind of get the real history of what's going on, because that's usually what's going to tell you what's going on. Do the physical exam, do the test, do the diagnosis and management. So, history, what do? All right, we find out. Simple thing, detective work. Same thing you see on Murder, She Wrote. When did it start? What triggered it? What condition was tried? How has it progressed? Okay, and then what's wrong? What is wrong with the voice? And you'd be surprised when people don't find out exactly what's wrong with the voice. Exactly. You know, what pitch? Are they having problems when they're doing the transition? How are they using their voice? You don't always get that information the first visit, because a lot of times the first time they come, it's like a job interview and they lie. They hide things. And so I have to kind of pry it out of them over 1 or 2 visits sometimes. What other problems are present there? You have to ask about these other things, you know, do you have horrible cramps? Do you have low back pain? You know, little things like that. You know, they come limping in with a walker, that's a tip-off that something else is going on. Okay, has this ever happened before? Okay, then you go into all the history of the past illnesses and operations. This is the dirty laundry aspect of their medical history. And the medications, the allergies, their view of the rest of the systems, the family history, the social history. No, we hate doing this thing. We've got to find out what other jobs they have other than the ones they're telling me about. What abuse do they do? And you have to go and not do they smoke, How much do they smoke? What brand do they smoke? If they say they don't smoke, and I see brown nose hairs, I say, when did you stop smoking? And they say, yesterday, you know. So there's little things you have to kind of pry into with little looks of history. And the risky behavior. Okay, what do they do that's risky? Okay, the physical exam, we do actually do a general exam, the ENT exam, the voice exam. I need to let everybody know what that entails so we don't scare the heck out of them. They think they're walking into a dark tomb and somebody's going to bring out an instrument by the marquee to decide on them. The mirror exam is not bad. It's no worse than looking at your back molars. The endoscopic exam with these things that we showed up there, what do they entail? They're not bad. I do them on myself, and I'm not sadistic or masochistic. It's just one of these things that you do to try to see what's going on. The stroboscopic version, why is somebody charging their insurance company $600 or $700 for this test? What do you learn? Why is it there? And was his voice evaluation fair? And it varies a lot from place to place and what tools they got available. The hearing test. If they can't hear themselves, they're not going to hear what they're doing right or wrong. So sometimes we have to do audiograms. Sometimes we have to do x-rays. Not on everybody. Sometimes they do all these little swallowing studies and scans, blood tests, pulmonary tests, and sometimes it takes several times to determine it. It's not cookbook. Now you get into the management. Now this is where the tough part comes with the education, and this is a multifaceted thing. The education is sometimes by me, sometimes by my speech therapist, sometimes by the student singing teacher. Wherever I get the help, I go for it. The education has got to be utilized by that person. If we can all spew all we want to, but if it doesn't get assimilated into a change in their behavior, I'm just fooling myself. So we try the behavioral modifications in what they're doing. We've got to get them to buy into it, to get their compliance, to get them to willing to work on it. It is a team effort. It is not the sort of thing that they can lie back, heal me, Jesus, and have something happen to them. It doesn't work that way. The vocal rest is variable depending upon the problems. Medication, surgery is, I know I'm a surgeon, but trust me, it is the last resort for these sort of things. And sometimes we have to do it quickly, but it is something we do and we're pretty sure nothing else is going to work because we're trying to save their careers. Again, here's some more vocal therapy here. Nice big old honking nodules over through here. These are biggies, and they've gone down. And so they get better with time. Now, do they go away? Depends on what they're doing. The catch is they don't have to be beautiful, virgin-looking vocal cords to be fine. And this takes a lot of our ENT doctors time to learn, is just because somebody comes in, they have no complaints, and you look down and say, oh, you have nodules down there. And this is a person who's a very successful singer, and you don't tell them they necessarily have nodules. You may say, hey, you got what I call worker girls cords. That's my little favorite term. And I say, hey, you bring them together. You got these little swellings in there because you're working on them. Okay, as long as they don't get any worse than that, great. But by and large, don't yell at the Titans game. Just zip it up. Do a Milli Vanilli. And save your voice for the times you need it. And so they just chug on very nicely with these. So I've got people with cysts. I've got them with polyps. I've got them with nodules. They're performing just fine. Do I cut them out? Hell no, I don't cut them out. It depends on how their function is. Now, this is going to be preaching to the audience because the audience needs it too. Students aren't the only ones, and there's a bunch of research coming out showing that the voice disorders in teachers and the general population and the effects on work performance, i.e. your ability to teach, and your attendance at work, and your sick days, and when you call in and all those, is a real problem. And fortunately or unfortunately, depending upon your bend, whether you're a performance or education major, a big chunk of your students in music schools are going to be education majors. They're going to teach some way, okay? So what you want them to do is you want them to teach for a long time. You want that to be a long-term career goal. And one of the problems is that they found that the teachers were significantly more likely than non-teachers to have experienced multiple voice symptoms and signs, including hoarseness, discomfort, increased effort while using your voice, tiring or experiencing a change in voice quality after short use, difficulty projecting their voice, trouble speaking or singing softly, and lost their singing range. Not that you all have ever had that happen to you at any time. And so these findings strongly suggest that occupationally related voice dysfunction in teachers can have a significant adverse effect on job performance, attendance, and future career choices. And so you don't want them dropping the career you trained them for after a decade because they can't do it anymore. So statistics on these things that Ryan's group and Kitty came up with Well, teachers. Well, as a politician certainly can tell you right now, it's the largest occupation with a single label. That's why they solicit their votes. You got about 7 million people out there, or about 5% of the employed population is a teacher in one shape or another, and their numbers vary all over the place, but anywhere between 11 and 47% experience a voice abnormality on any given day, and greater than 60% of all these teachers have work problems due to their voice. I'd say that's a pretty significant problem. Especially you get down to the bottom line that what strikes fear into any school administrator's heart is that there's about $2.67 billion lost per year due to teacher voice problems. Now you're talking real dollars. Okay, so those who are interested in getting the most bang for the buck out of your faculty at a music school, this is a number that's important. Okay. So, what's the teacher role in all this project? Well, first of all, they are the ones who will act to introduce the subject to the student. I'm not talking to them. I'm up here. I don't see them until after they busted, although I'd like to have an opportunity. They need to relate the importance of this, and it's a little easier to understand if the teacher understands the importance to their own voice. They have to work with a voice team on campus, and if there isn't one on your campus, you make one. You pull them out of scraps from wherever you can. You find the speech therapist who can walk and chew gum. You find the doctor who can communicate without being a stuffed shirt. You find these people and you build them yourselves if you don't have them already. And if they don't work out, you throw them out like a piece of Kleenex and get another one. Okay? You make your team. You incorporate the material that hopefully you all and we all will come up with in the curriculum and help the student recognize and get the help as they need it. So pretty much that is what we're trying to do on this thing. There will not be a test on this right after this. I hope you had a chance to scribble stuff down on this thing because you all will be providing the information on this thing and helping us to kind of zip on through it. Pretty much, did you want to talk about some of the retraining thing that you and Kitty are doing, or you want to do that a little later on? Yeah, my cell phone didn't come up and give me my happy smile, tell me it was 11 o'clock, but why don't we go take a break right now for about, Chris, what do you want, 15 minutes? The stretch and caffeinate and decaffeinate crowd? And so we'll meet back here in about 15 minutes, it'll be about 11 o'clock, okay? All right.